initiate the transmission on YouTube.
That's how it works.
I think we are on. Let me switch this video. Yes, we are on. And boa tarde, todo mundo. Meu nome... Bom, então mais uma transmissão do TEG Play, nosso canal de saúde e tecnologia. Essa é uma iniciativa da TEG Saúde em parceria com a 3778. Meu nome é Flávio Amaro, sou médico e consultor na 3778, vou ser seu host em mais essa transmissão. Como prometido, nós voltamos aqui hoje com o nosso convidado Lucien Engelen para o Round 2, uma rodada de perguntas e respostas sobre o futuro do ecossistema em saúde. No final de maio, a gente conversou com o Lucien a respeito dos 3 artigos que ele publicou no LinkedIn, e o vídeo está no nosso canal, que a gente disponibilizou no começo da semana passada, e agora a gente vai aprofundar um pouco mais essa discussão com uma sessão de perguntas e respostas. Então, mande aqui as perguntas no nosso chat, que a gente vai passar para o Lucien responder para a gente. Agora vamos conversar um pouco, já vou passar a conversa com o Lucien em inglês agora. So, Lucien, thank you very much. One more time. Wonderful to be able to chat with you again.
Gosh, I love listening to your language, and I did get round 2, so that's good.
All right, we're on the same page. So,
thank you for having me, Flavio, again.
No, it's a pleasure. Just giving the heads up about our previous talk, your articles, and the goals of this live. That it's going to be a Q&A about the future in healthcare. So, since our last...
Which is interesting, by the way. I'm sitting in this hotel room where the Wi-Fi internet totally collapsed. So I'm now connecting through Zoom with you on my 4G network, which works, you know. It's all about location, right?
Yes.
Sorry for that.
No problem at all. It's perfect. We can hear and see you just fine. Since our last conversation, some messy stuff has happened around the world besides COVID-19. But anyways, we are experiencing reopening in some states here in Brazil, and all the trouble that goes along. Well, life is keeping its course. Yeah? So
it's complicated.
Before we start with the questions, any considerations? Feel free.
Well, in general, I think, Flavio, it's like you said, it's very impressive times. We see a lot of stuff happening at the same moment. It's not just COVID, it's also the unrest as well that's happening throughout the world with all the protests and everything that goes with it. So I also see a lot of people trying to make their mind up how to cope with that. And that comes on top of the uncertainty that we experience in this corona pandemic, with all the uncertainties and how things will play out economically, for your family, for your work, and everything that goes with it. So I think in a couple, like we said last time, I think in 5 or 10 years from now, we all will look back and say, that was a pivotal time for many, many developments, and not only in healthcare, but specifically looking in healthcare. I think that the boost that technology has gotten and innovation has gotten in this era, hopefully, I would say, would stay at least for part of it, because we've now seen that technology that was present already for years and some even for decades, all of a sudden started to be used by many people. And actually, some of them were surprised that it worked so well. From that perspective, I think it's a very interesting time as well, and troublesome.
Well, just one thing that popped into my head just now. Do you think social networks, they are helping, or they are just setting fuel into this fire? What do you think?
So there's not one answer. I think social media is a brilliant tool for people to become educated, to find other ways to connect and reach out to people across the world. You can find tons of stuff, even some better than through Google, about your disease, and reach out to people that have, for instance, people with orphan diseases that are on the other side of the world that you can easily reach out to. There's also a flip side. Not only good news gets amplified, that's also with the news that you might not want to see, or is going to be altered, or being changed or edited. And we know about all these trolls that are out there, and these bots that are out there. So every good thing comes with a flip side, as we all know. I've actually written a blog about that this moment in time, and also the use of social media, got me puzzled a bit, because I also see that sometimes there's no real sane discussion possible anymore, because the moment when I would start to interlude with you on the internet and have a fruitful discussion, people would chime in and harsh standpoints of view that I would love to discuss, but then to discuss it in a real normal way. And for that, I think that the majority of the social networks, as we've seen happening as we speak, have real challenges in making sure that they themselves don't get behind a point where they cannot return anymore. Let's be honest, we've never had, whatever you think about the guy, we've never had a president in the US that is controlling and administrating his country through social media, as opposed to the Senate. So again, two sides of the same medal, and curious how that plays out. Yeah.
Okay.
I'll share that link, by the way, with you, so you can put it in the show notes with about the blog that I've written about it.
Nice, thank you. So let's begin here. It's the first one is one of my questions that I thought about asking you after our first talk. It's I read recently an article pointing the difficulties of non-English speakers in adhering to telemedicine and all that digital tools that revolves around it. For example, if a non-English speaker needs to schedule an appointment with his or her GP, they may be troubled by the online platform to do it. And the examples go further in other directions, like prescriptions, online automated orientations, and so on. Researchers, I think it was a UCLA study. They observed a drops up to 50% in appointments for non-English speakers after the ambulatory services shifted to telemedicine. Mm-hmm. So I was thinking about our reality here in Brazil. Our problem here is not non-English speakers, but not even non-Portuguese speakers. But our problem here is with non-digital speakers, so to speak. We have increasing elderly population, and a majority of people that just can't afford access to digital tools, or they don't yet understand it properly, and they can rely upon these tools, their health. So the question is not intended for you to solve this question, but to hear your consideration about digital inclusion, because that is how we could empower patients to have total control of their healthcare data and then share it to whomever they see fit. So what's your consideration of digital inclusion?
Well, I think there's a couple of perspectives that I would like to share on this topic. First of all, language: English, Portuguese, French, Spanish, you name it. I think that yes, many telemedicine programs at the start will be in English, because that's where it has been created, where VCs put the money in. But let's also be honest. I think that you and I and the majority of the people in this call have their smartphone that probably is set to Portuguese. And Apple and Google and all the other ones have been able to localize in terms of language the devices that they have. Sometimes it needs some extra effort. The same goes also for apps and platforms and stuff like that. So I think language is something that says something about the priority that the institution or the government or the company takes in really wanting to reach out to their targeting group, being the patients. So I think that's one. I think that's solvable. It's about money, it's about priority, all those things. The second one, which is about digital literacy, that's a tough one. Recently, there was some research been done in the Netherlands in curative healthcare, so like hospitals and stuff like that. 1 in 20 employees is digital not capable to come along. In elderly care, that's 1 in 10. So if you have a hospital with 100,000 people working over there, 10,000 people are not able to cope. Or if it is a hospital with 10,000 people, 1,000 of your colleagues take all kinds of tricks. They would say to you, hey, Flavio, could you enter this for me in this system? And I'll get a cup of coffee for both of us. They've learned how to work around, and they have their partner answering their work email by night, those kind of aspects. And so probably it's one of your colleagues that's sitting next to you. So I don't think that there's one solution for that. And I also don't think that digital healthcare or telemedicine, or whatever you would like to call it, is the answer to everything. What I would consider to do is that make sure that for those who can, who want, and who need it, there's also an opportunity to do some of those things digitally. Meanwhile, keeping the front door, the physical front door, open for all the other ones that are not able to, don't have the technology, don't have the money, or don't want to. So this is not only about people who are not able to, but I've done a lot of work with young cancer patients, the IAs, in the age of 18 to 35. And what they've told us back in the days that they said, sometimes I understand that I need to come every 6 weeks to my oncologist for this consultation, but it's like a 10-minute call visit, and I hardly can talk and discuss things with you. But last week I needed you for an hour and you were not available. If only I was able to, for those 6 consultations, to choose whether or not I could do that in a video call or through an email or through a text, SMS, or whatever. And whenever I need you, literally and physically, we have more time to spend to each other. So I think it's a blended model. I always like to say it should be digital first, physical next. And if only, let me take a side step. If only 20% of the total population will be able to run their healthcare digitally, if that would be a drug, that would be a blockbuster. Then we can take care of the other 80%, where we need to find different modalities, different approaches, and maybe even drive with vans into their neighborhood to deliver the healthcare to them, because then we have also time and maybe also even some money for that.
Okay. Speaking now about the healthcare, about primary care. This shift into a big data empowered patient, this shift into a big data empowered patient centered healthcare model. Wow. It's depending on gathering data, structuring, and interchange it. Thinking about this task, do you think primary care, the GPs, must be the main role in this future model? Like GPs must be the gateway to accessing healthcare system besides emergency, of course. what do you think about the role of the primary care in this big data-based model?
So in the Netherlands, the GP is the gatekeeper to healthcare. That's the reality right now. What I think that is going to happen is that role is going to be shifted over the course of the next decades. Whereas now the GP is the gatekeeper, and I think that the GP is going to be the guide through that woods with all those different options and modalities and technology that people can use, but also combined with the shift that we are going to make from healthcare to health, where the preventional aspect is going to grow bigger and bigger because we need to go there. And you might remember that in the slides that I showed this slide where that 6% of all the health impact is consuming 90% of the healthcare expenditure. And I'm not saying that we should stop that. I'm saying we should shift a bit of that more into that. And I think that that's a place harnessing and safeguarding lifestyle, navigating through health systems and new options, some of which might even not be from healthcare, but more in the health arena, like the ones that we've shared, for instance, from Walmart with their Walmart health clinics, which is all about primary care and those kind of aspects. So I think the GP will still have that central role, but that role is going to shift into a different, let's call it modality, and more of the navigator and like I said, also the maybe even the case manager a bit. I could imagine that would be the case. And if you could do part of that with the digital technology, you also could handle maybe even more patients and see those patients and talk to those patients, the ones that really need it and that you also think that's needed. And with all the technology also, you would be able to have more early diagnostic, like in early stroke warning, just to name one of those, to make sure that you can prevent people stepping into a life event. And all of that combination, to me, is going to craft a bit of a altered role that the GP is going to play in the next decade or two.
Okay. Okay.
Do you agree?
Yes, I think so. Here in Brazil, we have this. We begin to value primary care within
more.
Yes, value more the primary care within a decade, I think. So
yeah, I still remember those lines that I saw outside of a couple of hospitals that I visited when I was in your country together with Rens, and I was shocked. I said, why don't these people go into primary care? And then he told me how the system works, and so I think that there is a huge opportunity not only for primary care but for healthcare as such to give that more access and also more priority.
Yeah. Well, it's taking this primary care reasoning. As I told you, a good friend of mine, Luis Guilherme, he's our colleague here. He went to Nijmegen in 2014 to experience some of the Dutch primary care. He found out during his residency ship here in Brazil that Netherlands has outstanding results in primary care, and but he just didn't know about it. So he packed his things, went to Netherlands, to Nijmegen, and to see the healthcare system full throttle. And he made some questions to you, so I'm going to
I won't blame him for not visiting me back in the days, but that's it. and without being braggy, I hope. Yes, I think the Netherlands are known for a good GP system, first primary care system. Second, Nijmegen always has been the heart of that. And I think he also met with Chris van Weel, who back in the days was the professor of primary care. And that guy really also on a global level is one of the authorities. So I could imagine that he has visited him in 2014. Yeah.
Okay. So one of the first questions he made, the Netherlands has one of the best healthcare system, one of the most accurate healthcare data management system, and one of the best European medical education system from the medical residents' perspective. But it's still struggling with costs. Why does it happen? And will quality ever meet lower costs? Are we missing something?
So that question could take an hour and a half, Fabio.
I'm good in making these questions too.
Yeah, absolutely. So when you started to accumulate all those things, why we do some things okay and good in the Netherlands, I thought, I hope you also will mention cost, because that's the flip side. What I think that is going to happen over the course of the next decade or two is that from this primary care system, as we just debated as well, we will be able to figure out earlier in the process who should we see or not, and to also be able to have the referrals that are being done by GPs to the hospital based on better technology, smaller technology, cheaper technology that sits in the practice of the primary care, where we'll be able to refer better patients to the hospitals. And with better, I mean, we will know better which ones to refer and which ones not. That could be helped in a different way. Because that's the other thing that we see now. Many people get sent into the hospital, referred also by the GPs. And yes, they are the gatekeeper and they do an extraordinary job. Can that be done better? And I'm now echoing their own critic approach in that, yes, they can do better. So I think that with digital tools, with patients becoming more empowered, with more of a focus on prevention than we have right now, we could also get our fingers between the door on the cost aspect. And if that is the case, then we have, I think, a balanced system. So hopefully that is going to happen. It'll take a while. It also will take change of the curriculum for medical students that also become GPs and other people working in primary care. Let's not forget mental health, which is also part of primary care, as we know. So things are changing there. And I think from, for instance, a mental health perspective, there was a couple of mental health institutions in the Netherlands for 100% transferred all of their interventions also in the digital form. So that's not only, but also. So giving patients and giving the GP and giving other workers in primary care the choice, whereas there's now no choice. So hopefully that combination, combined with the data and the stewardship that comes with it that you mentioned earlier on, hopefully that also would be able to control the cost piece a bit more.
Okay. The other one I have here is that we have a lot of health inequalities here in Brazil. And when we compare with other countries like in the Netherlands, it's like we have a time gap between our countries. It feels like time travel's film script, you know, this gap. How do you see healthcare changing across the world? What defines its pace, this changing pace in different places in the world? And if you could, what are the basic conditions societies have to present for to enable big changes in healthcare to happen? And I'll add a question that pop up in here in our chat from Natasha. What do you think about healthcare system in developing countries?
let me try to answer all those 10 questions.
Oh, let's take
first of all,
from parts.
But first of all, let me take an easy one.
Okay.
And sorry for repeating myself, but whenever you have a healthcare approach or an intervention that is able to run digitally, you can more easily scale that than you could do in a physical sense. So whenever there's an intervention being created in Brazil or in the UK or in the Netherlands, once you're able to tackle the language kind of that aspect of that, you can see the scaling part. Let's take one example. We all know that Apple and Google now created this API for COVID tracking and tracing. Been done once, is now being and brought it throughout the world actually. So I think that utilizing technology can help speed up countries closing that gap, if the gap that exists.
Okay.
So I think that's one. I think that's an easy one. Easy as in answering, not in implementing. The second one, I think that we've always seen that countries lag behind on certain parts. I get questioned a lot. Can you help me? Which is the country that does it the best in terms of innovation and healthcare? And I say, there is not one country that does that. There's flux in Spain. There's flux in the Nordics. There's good stuff happening in Canada. There's tons of good stuff also happening in Brazil. There's not one country that gets everything right. So my point here also would be learn from each other. And I think that there are also organizations that have this global reach really could help in that. The other thing is that also reach out to each other, like your friend and colleague did. Come to the Netherlands, and not like in we know it best, but we should come to Brazil and go into other places and to share and to figure out and ask the right questions, because there's so much knowledge being reinvented over and over again on a daily basis, because it was not invented in Nijmegen, or it was not invented in Sao Paulo or in other places, and we really should stop that. The third thing it was the question about the health system. Can you repeat that one from Natasha?
Natasha asked if what do you think about public healthcare system in developing countries?
Yeah.
For example, Brazil. For example, you do Brazil, for example.
Well, in developing countries, there's a lot of aspects. One of which is that there's often rural regions that don't have easy access to healthcare and to health systems. And again, that's where technology really could help. Giving the opportunity that you, Flavio, could help somebody like 500 miles away, and giving advice also to the people locally to help them. So I think that's one. Second of all, I also think that with the opportunity that we now see in technology again, where technology becomes smaller and smaller and cheaper, we're also able to do more diagnostics in the fields and also on a cheaper level. I think that's also one of the aspects that runs into it. And the third one, I think, a bit tongue-in-cheek, to be honest. Over the course of the past 2-3 months, we all are glued to our screen. Yeah. Sharing knowledge no longer is being done in conference centers, no longer is being done in university classrooms, no longer is being done by exclusive events. It's becoming generic, it's becoming open and open source, it's becoming accessible for a lot of people. And mind you, if you talk about developing countries, over the course of the next 5 to 10 years, 10 billion people in the world will come online due to the fact that this internet is going to spread, and we in not so far distant future, we will have internet in suborbital space from Elon Musk and Jeff Bezos, and every inch on the world will have internet coverage. Apart from how that business model will look like, that's for later worry, I would say. But that opportunity also spreads knowledge. So I think combined with that, we will be able to share more knowledge. We will be able, let's take 5G. We now see that the latency that 5G gives actually surgeons the opportunity to operate 10,000 miles away, because that latency is almost gone. And that was one of the problems in connecting a robot surgery device to a patient in another place. And again, I'm not saying that that's the sole solution, but I think it will push the needle into it.
Okay. I'm willing to ask this question for you for a long time. How to begin teaching innovation at healthcare professional schools, like medical schools, nursing schools? How to begin the process?
So that's a bit of an open nerve at my end. And the reason for that is that in 2015, I, together with a group at Radboud University Medical Center, were able to change the curriculum of medical students. Flavio, that was a battlefield. We had to battle OB/GYN for 10 minutes to get out of their program. We had to battle cardiology for 10 minutes of their program so we could build this innovation curriculum. And we had to do the same with the internist and oncology and on and on. So it was a battlefield because we came to steal valuable 10 minutes of their whole program to build this new one. And still, I would say that is the road to go, at least one of the roads to go. Second of all, and I'm paraphrasing Churchill here, he always said, never waste a good crisis. So what we see now is that a lot of people during this COVID pandemic have figured out easy ways and other ways to do things. My advice would be, make those guys and girls that have done that ambassadors for change. Give them authority, give them a podium, organize events, virtual, in real life or whatever, organize breakfasts or what you like to, and organize in every healthcare institution a committee of the future. We all have committees on hygiene, right? We have our quality committees. Why is it that in none of the healthcare organizations there is a committee of the future? Thinking and authorized to think about what's next in the next 5 or 10 or even 25 years. We've seen in the hard stuff now during this pandemic how change can happen and how fast that can happen. And there is this great tweet that somebody, I don't know who has done that on Twitter, where it would state, who had the most impact in innovation in your organization? Was that the CEO? Was that the CTO? Or was it COVID? And everybody, of course, said COVID. So my hunch would be, try to get it baked into the curriculum, because then you have a sustainable model. Yeah. Next to that, do this on an everyday basis in small groups, where you would organize that and create ambassadors for change, because nothing works better than a colleague explaining to you how it works. It makes no sense for me to do that or bring somebody else in. It can help sometimes to speed it up a bit, but in the end, it's peer pressure and it's peer teaching as well.
Okay, nice. This one came from Silene Lima, from our chat here. Is there a healthcare AI, artificial intelligence, capable to gather various diagnoses of an individual with chronic disease and provide guidelines on the most efficient ways to proceed with his treatment? I think if I could enlarge the question, do you know any AI solution that could really deliver this kind of product?
Yeah. So I'm going to try to be cautious here.
Okay.
I think real, actual, tangible implementations of AI in healthcare are very, sparse still.
Yeah.
There's only a handful of those, maybe 2 hands. I don't know. Is nothing been done? Of course not. There's tons of stuff. But there's also this hype in terms of AI. When I look at a lot of the so-called AI applications and dive a bit into it, it has nothing to do with AI. It's basically machine learning, and based on machine learning, pattern recognition, machine learning, and then giving some answers. Real AI still is in the cooking. And there's a couple of those, and we've seen that now with radiology of interventions of lungs during COVID, assisting a radiologist or assisting another physician in helping them how to work. And that is going to work. But the assumption yet that as we speak now, there's this huge AI that we can bring into the mix that does all of that, I think that's still a bit out there. We will get there in due time. And this is not by all means a linear curve like we often think, like today a bit better than tomorrow. It's an exponential curve for sure. But I really want to express that from my perspective and my opinion, real AI in healthcare, and sure enough, there's a couple of those, but they're not living up the hype that a lot of people now use as we're working on AI. And I think Christina Farr, which is one of the leading reporters of CSNBC, a very well-known health reporter, she said, oftentimes now AI is I collect data from one source and sell it to another one and did some pattern recognition of that. And maybe that's too small of a focus, but again, I think a lot of work needs to be done. But we'll get there.
We'll get there.
And to build on that, Flavio, sorry.
No problem.
And I think the majority of those AI systems will assist patients, family, informal care, and professional healthcare workers in the choices they make and the way that they do it. There's this notion sometimes that people say, "Oh, no, doctors will be surpassed by AI," and I don't buy that at all. What I do think, and I don't know who that quote was, certainly not from me, but I cherish it. AI will not surpass healthcare professionals, but it will surpass healthcare professionals that don't use AI.
Yes.
And I think that's the thing. Don't be afraid of AI. AI is nothing more and nothing less than the shift that we've been making when we started to have digital radiology or have digital pathology, stuff like that. So it gives you more information, better information. It learns not only from your site, but also from all the other sites, like all the Teslas in the world learn from all those millions of miles that have been that they drive on a daily basis. So it will be very helpful. Nothing more, nothing less.
Nice. It seems like we arranged this, but we didn't. But the next question is about this. It's from Luis Guilherme also. Every big technology change cycle we experienced has transformed the way we work. That's the same that we are living in this fourth industrial revolution. In times like this, we extinguished, created, or reshaped the jobs.
Yeah.
Talking about the coming decades, what do you expect to see on a new healthcare workforce?
First of all, I think location is going to be way less important than it is right now. We will delocalize a lot of the healthcare interventions as they are becoming possible to do it in a different spot. There's a great example in the Netherlands, and I don't own any shares of all the companies that I'm bragging about, just so you know, but Philips has created this ultrasound knob that you can connect to your smartphone. The I think it's called the Lumify. So it's connected with a cable to your smartphone, and you as a GP or as a nurse can do ultrasound in every spot on the world, basically. So what happened in the Netherlands is that one hospital that I cannot name has seen a drop of 16, so that's 16% of referrals to the radiology department from the GP systems. Now all of a sudden they say, oh, wait a minute. So now they are doing jobs that we were supposed to do. So now we have two choices. Either we try to block that, or we go out and help them, because that's a change, a transform that we need, because we cannot see everybody anymore. So technology is bringing that more near to people, like Walmart is doing that with their lab result and their radiology and their nutrition coaches and stuff like that. So location is going to, for the workforce in healthcare, location is going to be less important than it is right now. And you probably will end up in a hybrid model between delivering physical healthcare and digital healthcare.
Okay.
Some even might choose to only start delivering digital healthcare because they can now switch on their system at 10 a.m. when the kids are at school, and they can switch it off at 3 p.m. when the kids get back, or variations on that particular topic, for instance. So that's one, location. The second, I think there will be new jobs coming up. People that have been trained as a physician or as a nurse will shift and specialize a bit in some of the areas that we will see. Genetic counselors, just to name one. It's, you can now buy for, what is it, like $100? You can buy a sequence of your part of your genetic profile.
Yeah.
But what does it say?
Yes.
They send you great graphs. So what? What should I do with that? Should I be worried? How do I explain this to my kids? Do I need to change my behavior? Stuff like that.
What should I do with this information?
You know, that's so. And that's also one of the aspects that I meant in my earlier answer about GPs, because I think GPs are perfectly suited to take that role once they step into it, which they've done for all years, by the way. So that's, new jobs will come in. Will jobs disappear? Maybe some will disappear in the end, but others will come back in place for that, I think. The third thing, in terms of how this will say something about the workforce, it's how you define workforce. I think very soon, and we see this happening already, you will get a great army of colleagues next to you as a professional trained healthcare worker. And we call them patients. Because patients are becoming more educated. They are creating their own data that is given context by the companies that are creating that. Their family chimes in as well. So they start to work on that healthcare field as well, not being a professional, a healthcare professional, but they will start to assist you. So whereas a lot of the patients for ages literally have been the subject, all of a sudden they become the co-worker. And so that's also something that brings in a cultural mind shift for many that would say, no, wait a minute, I got this. I've studied for this for 17 years, and I know Google is fine, but sometimes they get wrong, and of course I'm making a bit fun out of that, but the message here is that location, different jobs, new jobs, combined with people added to the workforce will come in for help.
Nice. You mentioned earlier in our conversation about mental health.
Yeah.
It has been a lot of talking about how mental health is suited for telemedicine. Yeah. Some advocate that you miss something about behavior, about corporal language, but someone advocate that no, it's perfect because we only need to talk talk whenever people are comfortable to talk. So mental health is suited for telemedicine. What is your opinion on the subject?
So I don't think that there's any solution, whether that's technology or the current interventions that we have now in mental health, is perfectly suitable for everyone. There is not one patient that fits all those criteria. It's often that blended form that you as a physician, together with your patient and sometimes the surroundings like the family, are bringing choices to the mix. So that's also why I don't think that digital mental health works for everyone. It doesn't. And it even does not work for people who would say, I would love to start with it, but at one point in their treatment, they would say, no. Now I need to smell you. Now I need to be able to sit at your table and look you in the eyes, not with a screen, but the key determinator here is choice. Choice for the patient, for the client, or whatever you want to name it. Choice for the family sometimes. And I could imagine that if I would be in mental health treatment, that sometimes when I got a bad day, I would love to get out and come to your office to talk to you. But sometimes I just want to sit on this hotel bed or whatever and have this conversation through a video system, sitting in the comfort with my own coffee and stuff like that. So I could imagine that more choice, and I think that choice over the course of the next decades will be a crucial factor in everything that we do, is that we will be able to give patients a choice, whereas now they don't have a choice. And that's what I like to refer to as the Copernican moment, as you know, where we have this shift and all of a sudden there's an opportunity to choose.
Okay. Another question that pops up here from our colleague Thiago Goulart is what do you think about blockchain in this context? Because we heard a lot of buzz about blockchain ruling the electronic health records, but all of a suddenly that came into a calm sea. You don't see so much talk about blockchain. But what do you think?
So, like with every technology, there is this hype cycle that Gartner described. Whereas new technology is being hyped at first, then it's at the top of their peak, and then there comes regulation, business models, ethical questions, hard stuff to be done and stuff like that. And then you get into this valley of death. And then in the end, it gets onto the plateau of production, let's call it like that. So I think blockchain was hyped too much. Like I think that AI is hyped too much at present for certain aspects. And it has not been able to live up to the hype yet. Meanwhile, we also see all those problems with blockchain. And I'm not talking about currency aspects of blockchain, but that we have to figure out how to really utilize those in the end of the day. I think a ledger system, which blockchain in the basis is actually the same as all the electronic patient records that you and we all have, which are ledger systems that we write things down and put a marker on it, was on that day, on that minute. And if you can automate that, and if that's shareable without the opportunity to change that, other than somebody noticing that, I really think that's very powerful. I still think that it has a chance to live up to it. It will be tough. And at the moment, I don't see big opportunities and big companies really stepping into it. So this might have been early work, too early work, maybe even. So I'm very curious to see how this plays out.
Okay.
I think in 2012 or 2014 or something like that, we created a program which was called Prescript, which was an electronic medication prescription system based on the blockchain that you got access to with your banking card and your random reader. So the reason for that was trust, because we all trust our bank card and the random reader systems that we had back in the days. And you trust also the banks. At least a lot of people do that. So we said, why not use technology that's already there and build something on top of that that gives the security of a blockchain? And interesting enough, over the course of the past couple of months, I've been asked a couple of times about that project. And who knows, maybe that's something that gets back into the mix.
Okay. For our last question here, a little bit about politics, but the general aspect of it. For achieving a healthcare, a modern or a better healthcare system, we must count on laws, congresses, and so on. Do you think this movement, this shift, will be organic, will just happen, or it will be needed for us to force it a little bit or be vigilant, because we are talking about patients and or people interests in getting hold of their information, their health data. In the other hand, we are talking about big corporations and healthcare system, and you name it. So what do you feel about it? What do you experience in your society that is a little in the future comparing to us? What is this game between society and is this societal shift and Congress's men and women?
So I've been around traveling the world prior to COVID, of course.
Back in the days.
And I've visited, just like your country, a lot of countries, and talked to a lot of governments and talked to a lot of physicians and healthcare systems, innovators. Never I have seen a government running prior to the market. What I mean with this, don't expect your government to be ahead of the curve. They most probably will be able, and that's their role and their task, to secure the things that you guys as professional have said, hey guys, so this is it. This is what we need. You need to bake this in a law or in regulations or policies, and then they will. So don't overestimate your politicians, that they will bring it from the front end back to you. So my advice always would be, make sure that you live it in practice and that you create tangible examples that you can show politicians and say, there's more where this came from. You need to help us. And only talking in terms of abstracts and talking about we could do this, that's not working. What we have been doing, at least from my own practice, show and tell, live the experience yourself, and make sure that it's tangible for them, and invite politicians early on, not only when it's ready, but invite them also when it's tough and when it doesn't work, because that's also where you can bring them into the mix, that they can see how tough it is and how they can help in the end of it. So, and this applies to every politics system in the world, I think. Once they see the benefit for patients of it, most probably they will make sure that it works. Don't overestimate the time that's needed for it. It probably will take between 5 and 7 years to get these things up and running. At least that's the average that I've seen up until now. Because there's a lot of debate going back and forth in it, and specifically on legislation, it takes a while to get a law passed.
Okay, nice. Okay, I think we got it. We have an hour of talking with Lucien.
It's a wrap. Yeah. Okay.
Yes. once more, Lucien, thank you very much. I hope you have enjoyed this as much as I did.
Oh, absolutely.
For our viewers. And well, I'll be in touch for another talk and reflections about the future of health, healthcare, life, the universe, and everything.
Let's meet in real life sometime soon, Flavio.
Okay.
And for all of you out there, thank you for watching. Thank you for your great questions. And again, I think the best thing to do is not sit and wait, go out and make it happen. It always has been the case in history. People change the world. Governments don't.
Nice, nice. Thank you
Thanks
very
again.
much.
Stay
bye,
safe. Bye-bye.
You too. Bye-bye. Pessoal, muito obrigado pela conversa, muito obrigado por ter acompanhado. Ficamos por aqui, então. Até a semana que vem. Muito obrigado.